Hi friends, today we are going to talk about acid reflux and depression. I will talk about some ideas what you can do for the depression. Also, I will talk about herbs and supplements. Why I'm going to talk about that? Because Angela Taylor asked me a question. What is the best thing to do to take for my depression and anxiety due to acid reflux or GERD? Okay, let's go. In this video, we will talk about somatopsychotic disorder and possible side effect of the medication. Now, you're wondering, what is that somatopsychotic disorder? It's a fancy medical term. It's a disorder that is secondary due to actually real health problem. It's a very well-known condition that could develop because patient has a serious disease. So every physician does know about that. Patient with cancer, HIV, autoimmune diseases, asthma, and acid reflux is not excluded from this list, may develop either depression or anxiety or both. And by the way, quite often, the depth of the depression depends on the severity of the symptoms. Why all of that happened is because patient does not understand the condition. So let's go and talk about the treatment plan, okay, for somatopsychotic disorder. The step number one, and the most important, understand your diagnosis. When I was young and beautiful in medical school, we had a professor. He said a very interesting, fascinating at that time statement. He said, success of the treatment in 90% of the cases, or in 90% of the case, depends on the correct diagnosis. Once when you have a diagnosis, the treatment is no problem to figure out. So do not leave the office of your primary care physician or your gastroenterologist until you have in your mind clear diagnosis. I have acid reflux and I have gastritis. That's it. You leave the office and now you are ready for the next step. Oh, by the way, do not attempt to treat depression or anxiety just by itself. You need to treat underlying problem. So you arrive home depressed, and the first thing what you do, you start the research project. What I have, what possible causes of this condition, and you write everything that you did research, all the topics. And then you create an action plan. Action plan is so important. When you create the action plan to treat your gastritis or your acid reflux, the next step you do, you tell all your friends, relatives, your spouse, your kids, that you are going to change your life and you need help from them, and they will help. Okay, you will be shopping differently, you will be cooking differently, and you need their support. And by the way, my experience is, if you tell your friends that you have a certain health condition and you on the diet or you take something, when you at the party and you say, oh, I'm sorry, I cannot drink wine or something else, everybody will just back up. It'll say, because I am treating my acid reflux and I cannot drink because Dr. Waks said so. So everybody will back up, I promise you. And then you start to execute your plan, okay? Then you can add few supplements to help to deal with your somatopsychotic disorder. So here are a few supplements: valerian, passion flower. You can buy either tea or tincture, even better. I like tinctures because their substances that will calm you down are right there, more readily available. You can experiment with Zen formula. Coffea surici is a homeopathic remedy you will take in case it's for the people who have train of thoughts run in their head. They cannot stop, like they're thinking, oh, I have an acid reflux. Oh, I'm developing Barrett's esophagus. Oh my goodness, I already, like in half hour later, I have a cancer there. So this is for this kind of condition. Okay. Oh, by the way, turkey meat has a tryptophan. Eat the turkey before bedtime. Magnesium and melatonin. So all of the supplements, and I will put links below for the supplements. You can look at them. Then you need to think about, if you are taking medications such as PPIs, consider, please, that they may actually create this depression. Here is a couple articles that I post for you, and the links are below, that actually documented association between PPIs and depression. And we also very well know that PPIs will create vitamin B12 deficiency. What B12 deficiency means? Anemia, low mood, low energy, which it could be taken as a sign of depression. Vitamin C deficiency, calcium, iron, magnesium deficiency. So think about substituting this medication with something else. You can substitute with H2 blockers, Gaviscon, Tums. They are known that it is known that they are not associated with depression. Okay, guys, if you have any questions, please ask here, subscribe. And that's it for today. Thank you very much. Bye-bye.